Today, we're diving into something pretty stark, a crisis that could genuinely unravel decades of progress in global health.
That's right.
We're looking at the unprecedented dismantling of USAID and what that means on the ground, especially for countries like Ghana.
Yeah, the scale is it's hard to overstate. USAID wasn't just a player, it was often the dominant force. Think about it, 30% of total official development assistance, ODA, in 2024.
30%, wow.
Exactly. So it's permanent closure, July 1st, 2025, and this huge 83% permanent cut across all development aid. It's not just trimming the budget.
No.
It's a systemic shock. It's fracturing partnerships, relationships built over many, many years.
So our mission here really is to unpack that. What does it actually look like for people? What's the human cost? And maybe where's the immediate hope? What can you do?
Well, let's start with the numbers, even though they're staggering. A U.S. appeals court okayed these cuts. We're talking nearly $4 billion gone from global health programs.
$4 billion.
And over $6 billion specifically slashed from HIV and AIDS initiatives. Just gone.
It's almost too big to comprehend, those numbers. But what does it translate to, like, in human terms?
Right, because that's what matters. There's a study in The Lancet projecting 14 million additional deaths by 2030.
14 million.
Directly because of these cuts. Lack of vaccines, medicines not getting delivered, basic food and clean water just not there anymore for many.
Didn't Boston University also find something recent?
They did. Their estimate is grim. Nearly 90,000 people likely died in just the last 6 months because the funding for PEPFAR, that's the big AIDS relief program, was frozen.
90,000 in 6 months.
And globally, the projection is maybe 95 million people losing basic healthcare access. That could mean over 3 million preventable deaths every single year.
3 million a year?
Yeah. It's not theoretical. Look at Côte d'Ivoire. About 70% of their antiretroviral medication, stuff keeping people with HIV alive, came via PEPFAR.
So that support just stops?
It stops almost overnight. For people depending on it, it's literally losing their lifeline.
Okay, let's bring this closer. Zoom in on Ghana. It's a lower middle income country, about 33 million people back in 2020.
Right, and Ghana's interesting because despite economic growth, there are still big health challenges.
Especially in rural areas, right? Things like clean water, sanitation, hygiene, what they call WASH access, it lags behind.
Definitely. And malaria is still a huge public health issue there, accounts for something like 40% of all outpatient visits.
And USAID Ghana had specific plans there.
Explicit commitments. They were planning to help get basic drinking water to about 500,000 people and expand WASH access for, I think, 200 health facilities and schools. Vital stuff.
So these cuts, in a place like Ghana, it's not just one thing.
No, absolutely not. It becomes this interconnected crisis. It hits healthcare security because services decline. It increases the disease burden. HIV, malaria, hepatitis B and C become harder to manage.
And supply chains.
Exactly. Vital supply chains for medicines and supplies get fractured. Local resources already stretched thin are just overwhelmed. And all those prevention efforts, severely eroded. It's like a dangerous feedback loop, Each problem makes the others worse.
So if this huge international lifeline is just, vanishing,
yeah,
what happens to the people caught in the middle?
That's the critical question. And it's where organizations working directly on the ground become even more essential.
Give basic needs. I know they focus on northern Ghana.
Precisely. They're an international nonprofit, but deeply embedded locally. They're offering that direct lifeline, essential food, shelter, medical help to people really struggling economically.
And they have a track record.
Oh, absolutely. A compelling one. They've run these large-scale medical outreach events reaching thousands. Like in one village, Jumanikere, they had a team of 20 medical pros screen 1,500 people.
Wow.
Yeah, and they partner, too. The Ghana AIDS Commission supported that event with 1,000 HIV test kits, condoms. They do health education and distribute sanitary pads. It's holistic.
And it's not just medical.
No, they've also tackled water access. Drilled boreholes providing clean water for an estimated 3,500 people across several villages, plus food distribution to fight malnutrition. Real tangible impact.
But let's be realistic. Give basic needs. They do incredible work, clearly.
Yeah.
But their fundraising goal, maybe $10,000 a year locally, you said, that could fund a couple more boreholes or test 22,000 people, which is amazing.
It is amazing impact for the resources.
Well, it can't possibly fill the gap left by billions cut from USAID, can it?
No. Realistically, it cannot compensate on that scale. And that That really highlights the vulnerability, doesn't it? It shows the fragility of relying only on these huge top-down systems.
What does it tell us?
It tells us that direct support, philanthropy going straight to these grassroots, locally embedded groups, isn't just like a nice-to-have supplement anymore.
It's foundational now.
It has to be. Their direct approach lets them cut through the broken supply chains, bypass overwhelmed systems sometimes, and just deliver help right where it's needed immediately. It's a different model, maybe more resilient in some ways.
So we've seen the scale of these cuts, just devastating.
Yeah.
And then the vital work of groups like Give Basic Needs, acting as a sort of bulwark against the suffering.
Yeah. Which really brings up a crucial question, I think, for you, for everyone listening.
Okay.
In this situation, with these big global policies failing, how do we, as individuals, as a global community, how do we redefine aid? How do we actually empower that local resilience directly? How do we sustain these essential services for the most vulnerable?
That's a powerful question to leave people with. And it underscores that any contribution directly to these groups really is a lifeline now.
Absolutely.
If you want to be part of that solution to provide that direct support we've been talking about, you can visit donate.givebasicneeds.org.